So we have 3 MBBS students who are presently doing their internship. And I'll request Dr. Anita Rani to moderate this session.
So good evening, everyone. Now we have come to the end of the session. And this, I can just see that the tiredness on the faces, but still, this is the last sip. And now this is very important because the 2019 batch was the one जिसके साथ ये experiment हुआ with the CBME, and the faculty were trained rigorously. But although we have not trained all the faculty members, but yet many of us were trained to deliver the components, the various components of the CBME. So these students who entered in the 2019 and then in 20, in the next session, one of them, they are doing their internship. That is the practical board where they are actually working. And this is they have their experiences, which are good, as well as there are some suggestions from students' point of view. So we have asked them to share their experiences. They have collated it, all their experiences from the 3 domains. One is the self-directed learning. So one of our students will be talking about their experiences of self-directed learning sessions. Another one from the ADCOM, and the third one is for the electives. So let us listen them, and that is a take-home message for us and also for the authorities who have created this curriculum, because we feel that there are certain good things, but there are gaps also. So this is a high time that whatever next session is coming for us, we should take a message from them and try to improve upon them. So I invite our students. First of all, I'll request Ms. Devanshi Katiyar to kindly come and share her presentation.
Good evening, esteemed professors and respected member of the chair. I, Devanshi Katiyar, am a student of the 2019 batch, and our batch was the very first stakeholder of the new curriculum, that was CBME. Today, I, with my peers, am going to present our views of the various aspects of the CBME that were implemented from our batch. And I am going to present the various challenges and also the good things that were there about the self-directed learning that started from our batch. Firstly, let's understand what self-directed learning is. Self-directed learning is a process where individuals take initiative to plan, implement, and evaluate their own learning experiences. It emphasizes autonomy of the learner, the self-regulation, and personal motivations of the learner. This approach is crucial in developing critical thinking skills and fostering lifelong learning habits, which we know are very essential for a doctor. Now, the various benefits that were there of implementation of self-directed learning were that there were enhanced motivation among the student. By taking control of their learning journey, individuals were more motivated to acquire new knowledge and skills. This intrinsic motivation led to increased engagement and better retention of the information. There was also seen that flexibility and adaptability also increased among the learners, and it helped them to navigate through various resources and adapt to different learning environments. These skills are essential in today's rapidly changing world. And it also helped in personal growth. The self-directed learning, it empowered the students to explore their interest and passion, leading to personal growth and fulfillment. Now, talking about the barriers and challenges that were there, firstly, it was the lack of structure. Without a centralized resource system, there were learners who struggled with in finding the right resources to study from, and hence they were unable to create a cohesive learning plan and setting clear goals. Establishing a structured approach is key to overcoming this barrier. Second, the biggest barrier of all was the lack of proper execution of self-directed learning, where in certain departments, the self-directed learning lectures were turned into proper lectures that that defeated the entire purpose, and that promoted passive learning instead of active learning, which is the motive of self-directed learning. And last of all was time management. One of the common challenges in self-directed learning is time management. Balancing learning with other responsibilities like evening postings can be daunting, and it required effective time management strategies. Now, the various strategies that I could think of to overcome barriers were to build a support network by engaging with peers, mentors and resources can provide valuable support and encouragement during the self-directed learning journey. The continuous reflecting on learning experiences, progress, and challenges enables the individual to adjust to the strategies, to refine their approach, and to stay committed to their developmental goals. And also goal setting specific, measurable, achievable, relevant, and time bound, which we also call as the SMART goals, by learner themselves help in creating a roadmap for self-directed learning. Clear objective provide direction and motivation as well. So in conclusion, what I would like to say is that we need to embrace self-directed learning. It empowered individual to take control of their educational paths and also fostered personal growth and skill development. Embracing the challenge and adopting effective strategies and embarking on a rewarding journey of lifelong learning and self-improvement. Thank you, everyone. That's all from my side.
Good evening, one and all present here. Myself, Atish Kumar Yadav, and I am from MBBS 2020 batch. And today I am here to present my views and experience on AdCom classes and their role in CBME. So first of all, the full form of AdCom, that is Attitude, Ethics, and Communication. And first of all, I would like to present the positive points of the AdCom classes. The first positive and the most important positive point of AdCom was the dedicated time allocation. There was a proper schedule from first year to final year, which included a proper timing from which and proper department inclusion, which allocated a proper time from which the AdCom modules will be taken. And what it did, it enhanced the communication skills of students, not only with the patients, but also with their colleagues. Also, what it did increase the ethical understanding of the students. In case what is ethically right and what is ethically wrong for the patients, and the decision which a doctor should make during treating a patient, that understanding was increased. It also increased the empathy towards patient and inspired a sense that they are not merely a client but a suffering individual which should be treated with empathy. Also, the practical sessions which were done during the AdCom classes were very, very useful, like use of skits, role plays, and stimulations. And the most important point was the clinical application. There was a clear relevance of AdCom lessons to clinical practice, which we saw in our wards and in our evening postings. The negative points which I and my colleagues somewhat experienced during these time was the engagement level. Some of students find AdCom sessions less engaging. And what was the reason why they found this as less engaging? Because of the perceived repetition. There were certain aspects which were taught so repeatedly with a less gap in between. So the student were slightly bored and found it monotonous. So, and there was also assessment challenges which were consistently assessing and measuring competencies relating to attitudes, ethics, and communication, which usually we found challenging. So, in my opinion, what would be the ways to improve these AdCom classes? Would be a development of proper assessment tool, that is creating a robust and consistent tool for assessing AdCom competency like Casper test, or using an individual approach of professor or some residents which which would like to see the individual approach of each student and how they are treating patient, how they are communicating with them and correcting them right away. And also we should also include the active learning instead of making it a didactic lecture like a PPT or slide and telling this is the way and this is how we should talk. We should ask the students themselves, giving the clinical scenario, and in between of the class we should ask each one of them how you would react to it. So also there should be enhanced feedback mechanism, and not only the student should go and just grasp what they have learned. Instead they should tell some feedback about every session which they have learned. And also there should be highlight on long term benefits. This means that not only we should tell the students that this, if you do this will help the patient to cooperate and tell effectively their feelings. Instead they should tell that this ethics and communication skills would not only help you in treating patient, but in your personal life also. This etiquettes, this attitude will help you in a long term. This would increase the engagement level, obviously. So thank you. That's all.
Good evening, everyone. I'm Vinay Suresh from MBBS 2019 batch, and I would like to start off by thanking the dignitaries for providing me this opportunity to share my views on electives and opportunities for MBBS students beyond the curriculum. So, what were some of the positive points regarding our electives? The addition of 2 electives after the third year of MBBS, as introduced by the NMC, represents a significant enhancement to the medical curriculum. As students, most of us learned a lot during this experience, allowing us to improve our practical knowledge and learn new skills. It also marked a stress-free period right after exams and before the beginning of the final professional year. So what are the issues and areas of improvement? Some departments and faculty were not sufficiently informed about the electives, leading to a lack of structured programs and planning throughout the elective. Since the electives were scheduled immediately after university exams, many students preferred to go home or relax instead of participating. I would also like to touch upon a few opportunities outside the home institution. There are multiple opportunities across the country that are tailored by recognized institutions and even the government of India for MBBS students. These opportunities are short-term internships or training that often range from 3 days to 8 weeks. They include training and exposure to lab-based research and basic science, as well as aspects of clinical research, neuroscience, molecular biology, and so on. We feel that gaining awareness and wholesome experience beyond the fixed MBBS curriculum is important in overall student development and education, especially if the student wants to aspire to pursue research and academia. So these are a few examples of such opportunities. The Medical Student Research Training MedSRT program by CSIR CCMB, the MBBS MPH internship program by the IIC Bangalore, the DIPS workshop or the Developing Indian Physician Scientists workshop conducted in JIPMER, the Corona program for scholars conducted by the government of India, the Department of Biotechnology. And one other example is the computational approaches to memory and plasticity camp in ICER Pune. So there is a lack of standard operating procedure or protocol to allow MBBS students to visit these institutions, both at the NMC guidelines level as well as the individual institutional level. And currently across the country, some students manage to acquire approvals from the deans of their institutions, while some are denied, leading to missing out on such opportunities. The issue lies in the timing of the student's visit. This would compromise his or her attendance during the MBBS schedule as per the set curriculum. There is one window of opportunity that NMC itself has provided during the electives period right after the third year and before the beginning of the final year. However, the guidelines are not clear and the SOP is not laid out clearly to facilitate such an exchange smoothly, and thereby we have missed out on such opportunities. So here are some of my suggestions. To improve communication, planning, and coordination among the organizing committee and the faculty in the department to ensure a well-structured program that students can benefit from and enjoy. Schedule the electives 1 or 2 weeks after the end of university exams to allow students to adequate time to rest and relax. To establish a clear SOP for students seeking electives and opportunities outside the institution, we should clarify the protocol for attending such opportunities during the MBBS course, as well as address how to manage attendance deficits. Some possible solutions would include extra classes, tests, vivas, or maybe even utilize the permitted 20% attendance shortage allowed as per the curriculum. Now, I understand that these might not be viable solutions, but I hope that we come up with solutions at the end of the day. Thank you.
Thank you. Thank you, Devanshi, Atish, Vinay. So we would like to felicitate you. We have a small, gifts for you. So I would request Apul Goyal sir to kindly encourage our students because they have raised their voices and will definitely be reaching to somewhere. Very well. Atish. Vinay.